Well, you're right on time for a newsfeed. Thank you for keeping TV47 and for joining us at this time as we update you on Matters News. It's exactly 1 p.m. East African time, and I'll take you through the news stories that have reached our desk as at now. So karibu sana. My name is Linda Alela, and as we start off, meanwhile, a plight of health workers have accused the government of failing to address their plight. The health workers claim that the government is yet to provide them with PPEs in some public hospital. Let's listen in.
Present are the Kenya Medical Practitioner, Pharmacist and Dentist Union, the Kenya National Union of Nurses, the Kenya Union of Clinical Officers, the Kenya Union of Medical Laboratory Officers, the Kenya National Union of Pharmaceutical Technologists, the Kenya Union of Nutritionists and Dietitians, the Kenya Health Professional Society. These are a registered trade union and societies that represent all healthcare workers, and they have the mandate to represent them in all areas of interest. As a union, and as leaders, we have just learned of the plan by the Minister of Health to amend the health law amendment, the health regulatory bodies acts without the input of the members. And the acts that are proposed for amendment, I will just highlight a few of them. One of it is the clinical Officers and Registration Act, number 20 of 2017, the Nurses Act, Cap 257, the Medical Practitioner and Dentists Act, Cap 253, the Physiotherapist Act, number 20 of 2014, the Health Record and Information Managers Act, number 15 of 2016, the Mental Health Act, Cap 248, the Farmers and Poison Act, Cap 244, the Nutritionist and Dietitian Act, number 18 of 2007.
And still on matters of health, staff members at Pumwani Hospital have tested positive of COVID-19, 41 of them, and 19 of these are health workers, while 22 are support staff. Now, the Acting Director of Medical Services at the Ministry of Health, Dr. Patrick Amoth, toured the hospital this morning to assess the situation. And Dr. Amoth says the hospital will not be closed, but services have been scaled down.
And the President of the National Nurses Association of Kenya, Mr. Obengo, on a fact-finding mission to be able to see for ourselves what is happening in Pumwani Hospital, and in view of what the Director has indicated. Of course, we know we have had targeted testing. Staff members have turned out positive. And just generally to see the measures that the hospital has put in place. One, to stop further transmission of the infection. And two, to support the healthcare workers who have been affected in one way or the other during this difficult period. We have had fruitful discussions with the hospital management team, the measures that we need to put in place, including infection prevention control like what you are seeing there. And I've been assured that we have sufficient quantities of PPEs, personal protective equipment. Further, we have agreed that beginning today, we'll have an isolation center dedicated for staff of the hospital at the School of Nursing for those who may not meet the criteria for home-based isolation. So basically ours is a mission of support and also fact-finding to be able to see what is on the ground, and to assure the public that we are doing everything possible, one, to stop further transmission of infection to the healthcare workers, but also the people who come to seek services here. So the hospital is safe. The staff who are working here are properly trained, and will continue to give them support in terms of capacity building in terms of proper gear, in terms of infection prevention control measures to ensure that as they work, they are not only safe when they are offering the services, but they also offer safe services to members of the public. So going forward, there's a remaining batch of about 100 staff members to be tested. Out of the 290 who are tested, 41 turned positive. All these 41 have been on home-based isolation. 2 actually have been discharged from home-based isolation care, and the remaining 39 are doing well. Nobody has gone to hospital for care, and we are hopeful that they'll be able to pull through without developing any symptoms of COVID. Remember, they qualify for home-based isolation because majority of our people are still asymptomatic. 90% of the infections we get in our setup are asymptomatic. Therefore, that gives us a very good platform to be able to implement home-based care interventions. And also because, home-based care is 9 times cheaper than institutional care. So we'll support the healthcare workers who are afflicted, but we're also going to work very closely with Nairobi Metropolitan Services to ensure that a facility in the School of Nursing is immediately put to use. I think that's all. Maybe I can open it up for a question and answer. Please tell us, can you coordinate that on our behalf?
Elsewhere, Kirinyaga MCAs have started to collect signatures from residents in a bid to dissolve the Governor Anne Waiguru-led administration. This comes days after the Senate dismissed an impeachment motion against the embattled governor. The MCAs, led by the majority leader, that is Kamau Murango, have said that they intend to double the 30,000 signatures threshold to petition President Uhuru Kenyatta to dissolve the county government. Should the MCAs attain the threshold, then they will be the first team of legislators to petition for a disbursement of their county, with the rift between them and Anne Waiguru seemingly widening. And the Kiambu County government has set aside an isolation facility in Gatundu South constituency to monitor and treat health workers who may contract COVID-19. This follows reports that up to 257 health workers in the country have contracted the novel coronavirus since March, with one succumbing to the disease last week. Kiambu Governor James Nyoro said that the county's health workers and residents will be prioritized in the county's bid to mitigate a potential COVID-19 surge.
Fungua.
The last 7 days have been very, very stressful to us. And I sincerely want to thank our frontline health workers, led by our CC, Dr. Murega. It has been an extremely stressful week. We started off with a single digit, and we've not only gone to double digit, but double digit that are increasing at an increasing rate. I don't know what the figures today will be, and I don't want to know. Yesterday, we had 49 cases. The previous day, we had 33, and on and on and on. So the curve is rising.
Kilifi County health workers in charge of COVID-19 patients have had experiences of stigmatization for handling victims of the deadly virus since it was reported in the country. They have encountered cases of people fearing to interact with them due to the nature of their job. Mariam Juma, a nurse in charge of the COVID-19 department in the county, says in such situations, and of course it's hard, and is now calling on psychologists to intervene and help them.
burnout zikikuja tunabidi tuite wahudumu wa saikolojia. Wanakuja wanatusaidia kimawazo, wanatuongelesha wote, wauguzi na pia wagonjwa. Tushawahi kupata wagonjwa ambao wako in denial, inabidi tuwaitie watu wa saikolojia wakuje wawaongeleshe. Na upande wa staff pia huwa tunafanywa kabla tuingie katika hilo jengo kuanza huduma, lazima tupitishiwe katika kuongeleshwa na majukumu yetu yanayotukabili mbele ya kazi tunayokwenda kukabiliana nayo. Stigma iko hata kwa fellow colleagues. The first time nilitumwa kwenda huko kwa isolation, wale wenzangu ninaofanya nao walikuwa hawataki kukaribiana na mimi. Kwa hivyo stigma iko na inatisha, kwa sababu ukiona wale watu unafanya nao kazi wanajitenga na wewe, na huu ni ugonjwa uko na hawa wagonjwa ni wetu, ni lazima tuwahudumie.
And to some more sad reality, a private school proprietor has converted his school compound into a farm to support himself through the COVID-19 pandemic. James Kungu, a director at Roka Preparatory, says he had to come up with something to sustain himself financially.
A private school proprietor in Kirinyaga County has converted his school compound into a farm to sustain himself financially during this COVID-19 pandemic period. James Kungu, who owns a Roka Preparatory School, said the closure of schools in the country came as a shock.
Hata baada ya kuwaza na kuwazua, nikapata wazo la kuanzisha huu mradi wa kupanda uwanja wa shule mimea. Ni baada ya kufikiria, je, tunaambiwa kila siku ya kwamba COVID haiondoki, tuko hapa kuishi nayo. Na ndio maana mpaka sasa naweza jivunia kiasi ya kwamba kama si chakula changu naweza kumuliza mwenzangu pande ule.
Kungu works alongside 5 other teachers who were caught in the COVID-19 crisis when schools closed. They help in planting, weeding and watering plants in the farm.
Sasa mimi tunashughulikia na upanzi, kuweka maji na kuhakikisha kwamba dawa ambazo zinastahili zimewekewa ili kusiwa na wadudu wote.
The farming project makes at least 2,000 shillings per day from the sale of chicken and farm produce. Kungu says currently they sell their produce in the neighborhood.
Customer wenye niko na wao wengi wenye wanatusaidia kila siku, wenye wanakula boga kila siku, matunda na mayai. Wengi ni wazazi wenye tu wale walikuwa wazazi wetu wenye walikuwa wametupea watoto. Na ninashukuru Mungu sababu pia wenye si wazazi niko na customer kama 6 ambao sio wazazi na wanakujia boga kila siku.
The teachers challenged others who have been affected by the effects of the pandemic to substitute their income through other economic activities. Andrin Kilemi for TV 47.
Well, sad as one would say, but commendable on equal measure. And moving on to another one, 4,000 youth from informal settlements in Trans Nzoia County have been absorbed in phase 2 of the National Hygiene Program, as Boniface Baraza now reports.
This launch comes 3 days after youth from Falkland slums complain of discrimination in the 10 billion program.
Kuna watu ambao ni walimu, kwa hivi sasa waendi shule. Bado mshahara wao wa shule unaingia katika account zao. Na kuna vijana wa hii area kama Falkland, St. Emmanuel ambao hawakupatiwa chochote, hawajapata kazi yoyote, hawana namna yote ya kujiendelesha maisha yao. Hao vijana mara nyingi sana wamekuwa wakishikwa na polisi, wanahangaishwa kwamba wanauza chang'aa, wanauza busaa. Jambo ambalo nataka kuuliza serikali kuu na serikali ya kaunti, hawa vijana mbona siwapatie kitu cha kufanya waweze kuondoka katika hiyo kazi mbaya ambayo mnasema wanauza chang'aa, wanauza busaa?
Nashangaa sana, kuna jobu imetolewa hadi kazi kwa vijana mtaani. Sisi nimeshangaa kazi jatupata sisi huku. Sisi tuko tu hivi kuhangaika tu kwa puya, kutembea tu. Hiyo kazi ya vijana ilikuwa inafaa tu itutokee tuipate pia, sina tufanye hiyo kazi hata kama ni kufyeka area, tufyeke area, siku kaa kila siku tu kwa puya.
However, Saboti Sub-County Deputy County Commissioner Blai Halif has disputed the claim, saying the residents in this slum will benefit in phase 3 of the program.
not all informal settlement will benefit at the same time. So first phase is gone. We're in the second phase, hopefully in the third phase. And we have requested the government, and we have done a proposal and recommendation for consideration of the remaining informal settlement, which we are hopeful will be considered in the next phase.
The Social Protection Initiative is meant to stimulate the economy of slums dwellers who are severely affected by COVID-19.
The National Hygiene Program is to provide a form of social protection for workers whose prospects for daily or casual work has been disrupted by the containment measures and policies put in place to limit the spread of COVID-19. This program is also structured as a local economic recovery program which aims to restore disrupted economic activity in informal settlements.
On his part, Trans Nzoia County Deputy Governor Dr. Stanley Tarus appealed to the residents to sustain the 6 months program.
If a sewage has been unclogged, a drainage has been opened up, please let us make sure it is not clogged or it is not clogged up again by maintaining the good hygiene practices our youth have done. So let us not think that this youth will be here forever to do the daily work which was being done maybe by the county government. It's a stopgap measure to empower the youth in this crisis time of COVID-19 so that our youth can get some sort of empowerment.
Kipsongo, Shanti, Matisi, Mitume, Tuani and Shimolatewa are the slums identified to benefit from the program. Boniface Barasa, TV47, Trans Nzoia County.
All right, and elsewhere in matters, of course, politics and development, Taita Taveta Governor Granton Samboja is now before the Public Accounts Committee, the Senate Public Accounts Committee, to answer or to give account on the monies and how they have been spent at the level of his county. Let's cross over there.
So evidence and how it has been spent must be documentation. That is not negotiable. The absence of documentation would also mean that the officers who were there, who preceded you, have broken the law. So you must also, if you look at 149, one of the Public Finance Management Act, they are duty bound to have those things stored electronically in a safe way. It has to happen. So if they don't have it, you must also demonstrate what action you are taking to ensure that the documents are there, which is also your duty. And then lastly, whenever you see such a query, it's also not just about the people who got paid. There is a need to see authorization for it. Payment for the sake of payment is not an accounting process. Every payment must be backed by a process of authorization that demonstrates that it was lawfully made.
Governor?
I think,
Senator Dulu, sorry.
Yes, I just wanted to ask whether the chief officer who has just responded at that time of the project being procured, that is number one. Number two, he's telling us that within a week he's going to provide the documents that were not there since 2017. Does that confirm you are going to cook those documents or they are available? Because some few minutes ago we are being told the documents are not available. And now you are telling us you are going to provide it within 1 week. Where are you going to get it from?
Governor? CC of Finance.
Thank you, Chair. I wish to confirm at the point of the procurement of this project, I was not there. I joined the county government in November 2018. That was long after the project had been probably completed. And when I was talking about the issue of 1 week, it's because we have a big archive which maybe due to the poor filing in the past, it might have been misplaced. That's why I was saying we confirm and then we give a report within that 1 week. Because last week we just focused on
point of order, Chair. This committee does not take answers or probability. You said with certainty you'll bring within 7 days, and the chair has ruled on that. So when you are going to an archive probably to do some probability and some, that is very, that's very strange.
Can you be precise, Governor? I think you better guide your CEC to be precise.
Just on, and I think if I was listening to what the CEO was talking about, you say that there is a pile of archive, and if I can tie that in with what the governor said earlier on, that he has not been able to locate these documents. So I think maybe the choice of words is the one which is an issue here. But because what happens if you're able to, if you go and look for the documents and you do not find? So I think, Governor, you should be precise and say, we will look for the document. If we cannot find them, we will report. Because that would be much better. Because if I tie in what you're saying, you've not been able to locate, and what you're saying, give us a week, we will, the only conclusion we can take is that you're going to document to present. So I think you have to be very clear in terms of your argument, in terms of seeking time.
Yes, Governor. And we must end now because time is up with us because of the afternoon session. CC Finance.
Thank you, Chair. Chair, we stand advised by Honorable Edama. We will look into our archives, and if they're not available for this particular project, then we'll report back to the committee and say they were not there.
Chair?
Yes, Dr. Chilo.
It would also be important to undertake to pursue what is provided for under Section 149. If your predecessors took off with the documents, or if you ask that they be returned, because Kenyans must always have these records beyond our being in offices.
We'll give you more details on those proceedings later on our subsequent news programs. And now, more than 70% of Legio Maria Church congregants are above 60 years. The church says that 90% of the church elders are above aged 70. The denomination, through a committee of cardinals, says that their worship sessions will be greatly affected if the government does not ease the restrictions already in place as the phased reopening of churches in the country begins today.
Mzee kama mimi namna gani atapata mimi wapi? Na watu na vijana ndio wanakuwa kwenye kanisa. Tunaomba serikali yetu uangalie mambo ya wazee, itakuwa namna gani? Mambo ya vijana vidogo itakuwa namna gani?
Kwa inasemekana ya kwamba palipo na wazee hapaharibiki neno. Tukikosa hawa wazee na vijana ndio waachiwe uongozi wa kanisa. Na kuna
And to our sports story right here, former athlete who represented Kenya in many athletic championships, Richard Matelong, is now serving as the OCS Rerengero Police Station in Subukia, Nakuru County. The 2008 Olympics bronze medalist retired after a knee injury, as Muhammad Ali now reports.
The 2008 Olympics bronze medalist Richard Kipkemboi Metlong is now serving the Kenya Police Service as an officer commanding station OCS at Kirengero Police Station after retiring from athletics. An injury on his right knee cut short his passion for athletics. Metlong says he really wanted to keep representing the nation and flying the Kenyan flag in other parts of the world during international track and field games.
Tuliweza kuacha kushiriki katika mbio hizo mwaka 2014 kwa sababu ya jeraha. Nilipata jeraha la goti ambayo iliweza kunilazimisha kuacha mbio hizo. Sikuwa nimefikiria kuacha, lakini nilipatikana na hilo jeraha na ndiposa nikastaafu katika upande wa riadha.
Metlong made his breakthrough in athletics globally at the 2007 Osaka World Championship, where he won bronze in 3,000 meters steeplechase, before getting the same medal at the 2008 Olympics in Beijing, China. He has urged upcoming athletes to be more disciplined and shunned the use of performance-enhancing drugs, saying that it is a career killer.
Ukipata sahi kuna majaribio mingi ya watu kutumia madawa, na kwa wale wanariadha maybe wadogo wanapata wanadanganya katika njia hizo na watu wengi. Inaweza kuwa ni mkufunzi, inaweza kuwa ni agent, inaweza kuwa hata ni rafiki ama ni mwenzako ambaye mna train pamoja. Unajipata umejiingiza kwa mambo mengine ambayo itakuletea shida kwa pande ya riadha.
His colleagues praised the decorated athlete as a dedicated police officer who serves the community.
Na nimefurahia kazi yake sababu hata ni mwepesi. Kazi ya polisi ni ambio na hapa na pale, na hiyo ni kazi anafanya vizuri sana. Sasa naweza sema sports zimemsaidia sababu hata mwizi akiruka pale ataruka naye.
The National Police Service is the home to world-renowned athletes, including Vivian Cheruyot, David Rudisha, Ezekiel Kemboi, and Julia Siego. Muhammad Ali, TV47.
All right, so that's the match that we had for you this afternoon. Looking forward to see you again tomorrow for Newsfeed. But you can keep it right here because we have so much in store for you, lots of entertainment and so much more in the world of news. My name is Linda Alela. Do enjoy the rest of your viewing. Bye-bye.